Good afternoon, and thank you for joining us. My name is Nikki McCoy, and I'm the Director of Technical Assistance for the Work at Health program, and I will be your host for today's session. Welcome to the fourth in a series of events that will provide you with information about Work at Health and workplace wellness. Today's session will illustrate the various steps to complete the CDC Worksite Health Scorecard online. Additionally, Work at Health program participants will have an opportunity to ask questions before the end of today's session. Before we begin, a few important notes. This event is being recorded. The recording is available upon request to Work at Health Customer Service Center. Audio for this event is provided via broadcast. If you need technical assistance or need to ask a question about today's topic, please use the Q&A panel on the right side of your screen. Although we will have a Q&A segment after the demonstration, you may submit a question at any time. Lastly, please note that this webinar is provided for informational purposes only. Participants should consult independent professionals to discuss how specific matters relate to your business or organization. I'd like to welcome all of our attendees today. So today we'll go over a demonstration of completing the CDC Worksite Health Scorecard online. And we will go to a live demonstration of the web browser and really talk about the steps it takes to complete the scorecard. So the Health Scorecard tool was developed in 2008 by the CDC's Division for Heart Disease and Stroke Prevention in collaboration with an expert panel of representatives from various federal, state, academic, and private organizations. In 2014, the CDC launched an online version of the tool, and that's what we'll be discussing today. And many of our CDC constituents encourage you to complete the CDC scorecard online. And while it is developed, it is still under development, and it continues to be refined in order to reduce user burden and increase the dynamic nature of the online tool. The scorecard is important because it will help employers assess what they're currently doing in workplace health. You'll be able to compare your organization's interventions to other employers also in the database. You'll be able to track your progress each year, and the tools provided in the scorecard provide a roadmap of interventions and strategies that can help you improve the health of your organization and your individual employees. So let's discuss the CDC scorecard format. It includes 16 topic areas, including an area on the demographics of your work site. It's a series of yes and no questions that represent the good, better, and best practices in comprehensive health promotion interventions. And so what we'll see is a series of topics, 16 of which that cover the gamut from tobacco control to lactation support. It asks various questions, including what type of promotions your organization provides, to even if there are AED systems available within 3 to 5 minutes of a collapse. So it's very specific. There are very specific questions that are asked in the CDC scorecard that allow you to really get a good picture of what interventions your organization might need. So how is the scorecard scored? That is a great question, and it's a complicated algorithm, and I think that the collaborators who worked on the scorecard together really worked hard to make it simple for us lay personnel to understand. So each item is based on a score from 1 to 3, with 1 being good and 3 being a best practice. And if you go through the scorecard, you'll be able to see which score individual questions or items were given. And they really reflect the level of impact that a strategy will have on health. For example, if you have a policy or formal communication about healthier food choices in vending machines or in your cafeteria, that would be given a score of 1 because just that formal communication or that policy won't necessarily impact health. In contrast, if your organization subsidizes healthier food choices or provides discounts for those healthier food items, that intervention has more impact, and the evidence shows that that intervention would have more impact on improving the health and changing health behaviors. And those items on the scorecard, an item like that would be given 3 points because it has a higher impact. So I want to, encourage, if you have questions, please ask them now. We will be gathering them to answer questions at the end, but I really want to spend a significant portion of time going over the actual scorecard itself. So when you create, the first step in completing the CDC's health scorecard is creating an account. And when you go to the CDC scorecard webpage, which we will do in just a second, you will be able to see an employer account, which really shows your employer profile. So what about the whole company or organization that you represent, that level of information. There's also an employer dashboard. And if your employer or organization has multiple work sites, you'll be able to see the work sites individually, and then that information is then rolled up into the employer dashboard. And then the health scorecard itself. There are 2 users for the scorecard account. There's usually an employer administrator and a team member. And I would suggest that you do have both of these roles taken care of, just because it takes the burden off one person having to enter the scorecard data. And always having a team member is better. And as I said, so the Worksite is for individual work sites, and the employer account would cover your entire organization. So when you go to the CDC scorecard website, you'll see here in the home page, you'll see a lot of information. There are some resources about viewing scorecard data, looking at sample reports, a glossary of terms. In order to create an account, you will go to the New User button that is there on the top right, and you will click that button, and it will open a series of screens and information. And if you are a returning user, you will get a login code, and we'll go over that returning user. But as a new user, you will go to Get Started. And the Get Started button will open up for you a series of questions that you will need to answer. So as a new user, you will not have an employer ID. So you will select, no, I do not have an employer ID. Upon entering that information, it will ask you if you'd like to register a new employer. And there you will select, yes, I would like to register a new employer. Once you have selected those buttons, it will open for you a registration for your employer site. And so at that point, you will enter in the demographic and profile information for your employer. There you see a series of information about the employer name, the employer address, and you will want to register your employer. You must have at least one employer administrator and point of contact. And as I said previously, it's always a good idea to add a team member, and we'll show where you can add a team member when we go over the scorecard online. Once you have registered and filled in all of the demographic information, you will get an automatic, an auto-generated email welcoming you to the health scorecard. That email will have in it a unique code. And I like to say put that code in a safe place. It does not relate to your organization or company. It is a randomly generated code. And so keep that code in a safe place. You will need it to enter the scorecard system at any other time. So once you have, you've entered your account, you will see the employer dashboard shows you some reporting features as well as any other work sites that you've entered. And so you'll want to have at least, you have to have at least one work site registered in order to access the scorecard. And so you will select register a new site. There's a plus button there in a green circle. And once you've done that, you will enter specific information about your work site. And if you have multiple work sites, you'll want to register, again, a new work site every time. Here I want to just draw your attention to the fact that here is also the location where you would add a worksite team member. And so you have the two roles that we talked about, an employer administrator, who if you have multiple work sites will be able to see each work site information as well as the overall employer information, but you can add a work site team member to be specific for that particular work site. If you add a team member, that team member will also get an auto-generated email that will give them a login code for the work site. All right. And again, I would say always have them keep that login code in a very safe location, and the team member will need that to get back to the scorecard, and they will be able to look at any reports dealing with their work site and look at the individual responses to questions. And so now I'd like to go to the website directly and view the scorecard so that we can work through our process. So I have, it should be, there's a small lag, sorry about that. So I have already registered an account for an organization near and dear, and so I will just walk through as a returning member. So I have, sorry, some security settings, there we go. So I'm going to enter then my code. Hopefully I haven't forgotten it and I kept it in a safe place. And it will actually show me the scorecard. So I have my screen maximized so that we can all view it. So I have already gone in and entered in information for my organization. And so what I'd like to show you are some features here that will be important when you go in to look at your company. And so what you have here are is that work site that I have already registered. As you'll see, here's an option to add additional work sites. I have gone in just for the sake of time to use our time wisely together today. I've gone ahead and entered in several bits of information into the scorecard, and it will give you your progress that you've gone through. So here it's relating that I've completed 93% of the scorecard. Also want to show you that here I can also update information. I can edit who I am, edit the employer profile, ask for it to reset the login code if by chance I've shared the code with the world and want to have that reset so not everybody can see my settings. So here I just want to point out that there are several places where you can enter information here. So the way to get into the scorecard at this point is to select your employer name. And I'm going to make the screen just slightly smaller for a second, and then I'll then back out because I just want to show you some things here. So here when you're looking at the scorecard, this is really your dashboard to see where you are in relation to completing the scorecard, as well as any other reporting that you might see. So here on the left, you'll see the scorecard and all of the information that I've entered. So I think I stated there are over 100 questions in the 16 sections, I think 144 if you add in the website demographic questions, and it will show you each of the sections and how many of those questions I have answered. One thing I want to highlight here, and I'll repeat it several times, is that it will not allow me to submit the scorecard to CDC until I have completed the question. And then here I can view other reports, but again, I can't view reports until I've submitted the scorecard to CDC, and again, just some other information about how to update my Worksite account, how to update my employer. So one of the key things, and it's not necessarily very intuitive, is that these are actual live links going to the sections of the scorecard. So if I were to go to organizational support, taking it just a second, it actually takes me to that section of the 17 sections about organizational support. And again, I've answered all of these questions. And as you're working through the scorecard, you want to answer yes or no, but you will want to select, I would suggest that you hit save on several occasions. You cannot oversave. And one of the things I want to highlight here is the navigation. You can navigate a couple of ways. You can navigate using the arrows here that will take you to the next section. And you can also navigate using this drop-down bar. So here, it drops down and opens every topic area available. And you could go to stress management. And I don't believe I've answered all of these questions, which is good. And so I will answer that question for my organization and select save. So what I want to do is go back to the dashboard to really show me where I need to go and what questions I need to finish. One of the things I want to also emphasize is that you don't have to do this in one sitting. It can be very daunting to try to finish all 144 of these questions in one sitting. And you can select save and come back to these options at any time and come back and complete the scorecard. So what I will do right now, just because you all are watching me, is complete the scorecard for my organization, the questions that I have not completed. And what you'll see is I'll use several techniques to navigate back and forth, and it'll show me, again, I was at 93% earlier, and I'm now at 95%. So I will go ahead and complete the remaining 5%. I need to go to high blood pressure and complete that answer. And I will go back. I think everything is at the end. If my recollection of being incomplete is accurate. So here we will go and we will finish that. And I'm working it through this way in order to, again, as I said, the Submit to CDC button will not appear until I have answered these questions. And so you want to make sure that you've completed the scorecard to the best of your ability. And one thing to also note is if you don't have to worry about being the only person to answer these questions. I actually had the benefit of talking to our HR department about several of the bits of information that I am completing today to make sure that I had an accurate picture of what was happening for my organization's wellness program. So I am almost done as I try to multitask and talk to you while completing the scorecard. I probably would suggest that you not try to do a presentation and complete the scorecard at the same time. And we are almost done. Two more sections, I think, with a couple more questions. And last section. And one thing I want to note is that there are some questions that are not scored. And this is the section, the community resources section is actually not scored. And part of that is because, you know, these are things that are outside of some organization's control. So here we have completed all of the questions, and you see one of the things that is shown up here is instead of having a navigation to take me back, which I'm sure it would allow me to, it has now made the button Submit to CDC available for me. So it wants to make sure that I am sure that I would like to submit. And I just stop here to point to this pop-up button because once you have submitted your answers, these responses are final. And the scorecard becomes view only for you, you will be able to look at any of your benchmark reports. So even if you finished, if you're not quite sure, you want to go back and check some answers, you want to click, before you want to do that, you want to hit save, and you can come back, and the submit to CDC button would still be available to you to go ahead and complete the CDC scorecard. So here, before I go back to the slides and take your questions here, it actually shows me the scores that we have, and congratulations, we have finished. And it shows me my scores, and my total score available is 264 points. My organization has 143 points, and that will allow me to look at benchmarking reports and compare it to organizations of the same size. And there are some questions about industry, and I believe you can look at benchmarking reports for that. I'll just stop here, and we'll go and look at some slides. I want to note that there will be an upcoming presentation on looking at your benchmarking reports, and so that will become important and in some follow-up sessions. So at this time, I do want to just show you some resources that we didn't quite get to on the presentation, because I think they're important and will take you, give you insight into completing the scorecard and help you prepare and collect the information that you need before you complete the scorecard. So one is the CDC Workplace Health Promotion page, and that has highlighted some programs, including Work at Health, very exciting, and the Worksite Health Scorecard. There's also information about assessing and planning and implementing and also evaluating your wellness program. The next two are the website we just went to, which is the CDC Health Scorecard website, as well as the manual, which includes highlights of questions so that you can gather that information. And finally is a section about resources for action. It's some guidance, it contains some guidance documents that list available resources for employers to take action, and it has topic-specific layouts. So if you want to know how do I work on lactation support in my workplace, you can go to that site and select that topic and find out information. And then lastly, CDC encourages you, if you have any questions, to visit, to send emails to the CDC Worksite Health Scorecard email address, which is there at the bottom of the page. So at this point, at this time, I'll take any questions from the audience. All right, so we have a couple of minutes left, and I have a couple of questions from the audience. So someone asked about how often to complete the scorecard. So the CDC recommends that you, because most of the questions are geared toward activities that have occurred in the last 12 months, it is suggested that you take the scorecard annually and not on any sooner frequency than that, because they want to be able to look at the change in the programming as you go through and make sure you've had time for interventions. The last thing that you'll also notice is that another question is about what if you had programs that ended. So if you had 3 months ago a walking challenge, then you would be able to count that in your CDC scorecard as something that occurred in the last 12 months. However, if you had a nutrition program that ended and died out and is no longer active, you would not be able to count those activities. So there's slightly nuance in how you complete that and what time frame you're looking at. Okay, I'll take a second to encourage any additional questions in the Q&A panel. We have about 6 minutes, so I want to give folks time. We have another question about if you completed the scorecard last year, has any of that information been saved with the CDC? So the question is, the question really is about how you completed the CDC scorecard. So if you completed that information online, that information should be there. If you have your login that you use, that information will be able to be there and stored. If you completed the CDC scorecard on paper, that information has not been a part of the CDC database. So that's why we are encouraging all of our program participants to complete the CDC scorecard online. If you have your responses from last year and still have that copy of your paper version, I would encourage you to go ahead and enter that information into the scorecard and get your information listed so that a year from now you'll be able to then compare to programs that you've implemented over the last 12 months. So one additional question is coming in. So it says, when completing the scorecard at the end of the program, if your number of employees is significantly different at the time of the repeat scorecard due to seasonal employment, do you complete the scorecard in relation to full-time employees only? So there's a section of the CDC scorecard that actually relates to only your program's demographics. And I believe that is in the demographics section of the scorecard and says it is only for full-time employees. And so you want to, at that point, have that information only relate to those numbers of employees. What I would suggest that you do is look at the timing of when you entered in that information and make sure that you've accounted for and included in your worksite demographics the number of full-time and part-time employees in that demographic so it can be adequately compared and equally compared to other organizations who've completed information. I have another question that says, if I'm a consultant using the scorecard for a client who has access to the report, let me make sure I've read that question right. If I'm a consultant using the scorecard from a client who has access to report and complete it. I'm not quite sure about that relationship because the scorecard is free and easy to use. I'm not really sure about the use of a consultant. You should log in, and that information should be used by the employer. So I would have all of the employer information, and you could have that person be added as an employer administrator and then have yourself be added as a team member so that you would both have access to enter information and view those reports. So there are multiple stages to complete the scorecard. I have yet another question about if you have a question about Worksite. So if you have multiple Worksites, do you fill out a separate scorecard for each site? And so that actually is a very great question. When you do the scorecard, you are talking about a Worksite. So it is Worksite specific, and that rolls that up into your employer. So when you go and register your information, you will register an employer with multiple Worksites. And so you want to be sure to enter in specific information for your Worksite. We have another question about, are there any fees for CDC's analysis or services, if you complete a scorecard one or more times, then decide not to continue, do you need to terminate your registration? And I think the answer to that question is no. This is a service provided by CDC. There are no fees for use of this. This information is a two-way street. The information you provide helps CDC think about evidence-based programs and the needs that are out there in work sites across the country. So there aren't any fees, and if you decide you don't want to do another scorecard, there's no penalty for that. So I hope I've answered your questions adequately, and we're going to start wrapping up. All right, well, I want to say thank you to all of our audience members for participating. We value your feedback and appreciate you responding to the rating poll that will appear on the right side of your screen. If you have any questions or comments about today's session, please contact us using the information on your screen. Remember to register for our next event, which is scheduled for Tuesday, April 22nd at 2 p.m. Maury Ryan, who is the Certified Worksite Wellness Program Consultant and the Chief Executive Officer and founder of Advancing Wellness, will host our 5th event titled, What is Wellness Accreditation? Again, thank you for joining us. This concludes today's session.